Hello dear participants, I hope you are enjoying the training so far. I will be taking you through another session on medical social work, and this time we shall be having a discussion on how medical social workers contribute to healthcare outcomes. Medical social workers are professionals who work in healthcare settings to provide support, counseling, and advocacy for patients and their families. They help patients navigate the complex healthcare system and address social, emotional, and financial issues that may impact their health outcomes. Medical social workers play an essential role in improving healthcare outcomes by addressing the social determinants of health that can affect a patient's overall well-being. One way medical social workers contribute to healthcare outcomes is by addressing the social determinants of health. Social determinants of health are the conditions in which people live, work, and play that can impact their health outcomes. These include factors such as access to healthy food, safe housing, transportation, education, and employment opportunities. Medical social workers work with patients to identify these factors and develop strategies to address them. For example, a medical social worker may work with a patient who has diabetes but does not have access to healthy food options in their community. The medical social worker may connect the patient with local resources such as food banks or community gardens where they can access fresh fruits and vegetables. By addressing this social determinant of health, the patient's overall health outcomes may improve. Medical social workers also contribute to healthcare outcomes by providing emotional support for patients and their families. A diagnosis of a chronic illness or a serious injury can be overwhelming for patients and their loved ones. Medical social workers provide counseling services to help patients cope with these challenges. For example, a medical social worker may work with a patient who has been diagnosed with cancer. The medical social worker may provide counseling services to help the patient manage anxiety or depression related to their diagnosis. By providing emotional support during this difficult time, the medical social worker can improve the patient's mental health outcomes. In addition to emotional support for patients and families, medical social workers also advocate for their rights within the healthcare system. This includes ensuring that patients have access to appropriate care and treatment options based on their individual needs. For example, a medical social worker may work with a patient who has a disability and needs accommodations to access healthcare services. The medical social worker may advocate for the patient's rights to access care and ensure that the healthcare provider is meeting their needs.